Master, fellow Toastmasters, and honored semi-guest. So, speech number 2, CPR. I feel motivated to start my speech by taking you back in time to a critical moment in my life. 8 years ago, I was admitted to the hospital due to recurring bouts of sickness. On my first few hours as an inpatient, I suddenly lose consciousness. So my doctor tries to wake me up, but instead he finds out that I am not breathing and that I have no pulse. So he rapidly activates the emergency response system, gets the defibrillator, and starts providing me with chest compressions and defibrillations until my heart starts beating on its own again. That day, I suffered a cardiac arrest, but the effective response of my rescuer saved my life. For this reason, today I want to speak about 3 things. First, I want to discuss what a cardiac arrest is. Second, how can a cardiac arrest be reversed? And third, what you can do to save the life of a cardiac arrest victim in case of an emergency. According to the American Heart Association, cardiac arrest is the abrupt loss of heart function in a person who may or may not have diagnosed heart disease. So many victims appear healthy. That is, we know known heart conditions and possible risk factors. So the time and mode of death are usually unexpected. More than 420,000 sudden cardiac arrests occur each year in the US, and 80% of them occur at home. That is more than 1,000 a day, but just less than 12% of victims survive. Yet, with effective CPR and early defibrillations, the chances of survival for cardiac arrest victims can double or even triple. CPR stands for cardiopulmonary resuscitation. It is a rescue procedure used when a person is not responsive and not breathing, or not breathing normally, also known as gasping. If a person's heart isn't effectively pumping blood on its own, another person can perform CPR by pushing in the middle of the chest to help keep oxygen-rich blood flowing to the person's body. That keeps the brain and other organs alive until the heart can be restarted with a defibrillator. In short, a defibrillator delivers an electrical shock to restore the heart rhythm to normal. Putting both together, with effective CPR and early defibrillation, putting both together, a cardiac arrest may be reversed if effective CPR and early defibrillation is performed within a few minutes. Now, imagine that you are walking in the street when you witness a person collapsing. You try to wake up the person, but she is unresponsive and not breathing. What would you do? For people that lack previous training in CPR, the American Heart Association encourages CPR with just chest compressions. I have a handle to pass out. There you go. If a person collapses and you cannot wake up the person, call 911 and start chest compressions. Place the heel of your hand in the middle of the chest. Then, place your other hand on top and interlace your fingers. You want to push hard and fast. If an AED is available or a defibrillator, use it. All you need to do is to turn it on and follow the prompts. And most importantly, do not give up. I was kept alive for 45 minutes with CPR and defibrillations, simply because my rescuer didn't quit. So, what does this mean to you? If 4 out of 5 cardiac arrests happen at home, the life that you can save by correctly applying CPR could most likely be that of a loved one. So, learn CPR and be ready when an emergency occurs. Thank you, Mr. Toastmaster.